My name is Haley Alcorn, and this presentation is over Six Sigma for healthcare. Six Sigma is a quality improvement tool used to reduce the variability in any given process. Reduction in variability ultimately suggests a reduction in errors. In the figure on the right, you can see why Six Sigma has its name. In the middle is your process mean, and the object of Six Sigma is to get your errors to be 6 standard deviations away from your process mean, meaning that it's very unlikely to happen. So this process does involve a lot of statistical analysis, but the actual improvement part that you use is a 5-step process, DMAIC. DMAIC is an acronym for Define, Measure, Analyze, Improve, and Control. In the define phase, you want to define the problem in the process, and you need to decide how to make it quantifiable because Six Sigma is a very statistical process. In the measure stage, you want to quantify the current sigma level by gathering data on the current process. This gives you your baseline data. In the analyze phase, you want to look at data to find possible areas for improvement. In the improve phase, you implement the change and gather data to determine if the change is really an improvement. And in the control phase, you continue to implement the changes that were improvements and discontinue any that were not improvements. And you will keep repeating this process until you reach the Six Sigma mark. Benefits for Six Sigma for healthcare include safer culture due to decreased errors. The Six Sigma way focuses on decreasing defects in a process. This could be applied to healthcare as decreasing the likelihood of never events. To account for healthcare staff being human and having the potential to make errors, it is important that we focus on improving the process to decrease the likelihood of those errors, because humans will make mistakes. This could be an instance of how timeouts got started to prevent amputations of the wrong limb and on the wrong person, things like that. It also works for barriers in healthcare by focusing on improving the process rather than directly improving the outcomes. So, regardless of your thin staffing or distractions, it's going to improve the process to make it work even with those barriers. There are also limitations for Six Sigma in healthcare. One of these is that the projects must be very quantifiable for statistical analysis, because you will need routine statistical analysis to calculate your standard deviations and your mean for your project. Also, Six Sigma is a process tool and not an outcome tool, so it's not directly related to patient outcomes. Another limitation is it can be expensive to implement. If you want to truly implement Six Sigma, you could buy a Six Sigma training program for your office or for your hospital, and they will teach you the tools and give you spreadsheets and tools to use to do your analysis, and also just other quality improvement tools to go along with it. But it does come at a price. Six Sigma can be applied to the primary care setting. Griesing reported this study that used DMAIC to improve hand hygiene compliance to 99%. This is still not at the Six Sigma mark, but it is a drastic improvement. So how they did this was they defined a quantifiable problem, which was incidence of hand hygiene use, measured the current compliance rates for baseline data, which were actually pretty scary in this study. It was around 60%. They analyzed problems with the process, which was really what was key to their success with this. They found that the location of hand sanitizer dispensers and staff forgetfulness were leading to most of their incompliance. They made improvements by changing locations of the sinks and hand sanitizers, and they started using technology to track employee compliance with this. This was at a hospital that they actually did this study, but it could still be applied to primary care. And what they did, they had little electronic deals on the hand sanitizer, and little electronic deals attached to your badge, and it would activate whenever you were washing your hands. So they could track all of this just with technology. And then they controlled by implementing the system and continually monitoring the compliance rates, which was easy to do whenever you have those technology tools calculating them for you. Another instance of Six Sigma that could be applied to the primary care setting would be decreasing patient wait times. This is focusing on improving a process. They defined the project outlines, which were to decrease wait times. They measured the current wait times. Then they analyzed ways to decrease wait times and improve customer satisfaction. They found that patients wanted a less than 20-minute wait. To reach this goal, they had to create a new registration project and reconstruct the patient flow throughout the department. They controlled by implementing the improvements, getting rid of the ones that didn't work, and continually monitoring the wait times. And by the end of their study, they still weren't down to the 20-minute wait time, but they had improved down to 22 minutes. This goes to show you that in healthcare, you will not reach the Six Sigma mark every time. However, the DMAIC cycle will improve your results in your process. As an advanced practice nurse, you can use Six Sigma to improve your processes that you do. One of these is documentation. And because reimbursement is becoming tied to quality of services rather than quantity of services, it's becoming more imperative that we document efficiently. And we all know that if you didn't document it correctly, it didn't happen. You can use the DMAIC cycle to improve the documentation process, ensuring that it is timely and accurate. Electronic health records, when used correctly, can decrease the number of denied claims. To decrease number of denied claims like they did in this study, you can use the DMAIC process, where you define the project outline, being that you want to decrease your number of denied claims. Measure your current data and how many denied claims you have. Analyze the data and find out why the claims are being denied and which areas you need to improve on. In the improve phase, you can make improvements to the areas that were most affected, such as whether documentation was too vague or whether it was not done in a timely manner. Then you can control this. In the study, they were able to make drastic improvements by just changing the process with their documentation. And then they controlled this by continuing to implement their new documentation process. Another instance for using Six Sigma as a QI tool as an advanced practice nurse would be improving the process for outpatient referrals. Many electronic health records now integrate a referral process into them, but the study found that there were many problems still, even with the advances in technology, with this referral process on the EHR. You can use DMAIC to improve this process. They defined that they wanted to decrease the delays in patients getting referral appointments. They measured their baseline data to see how long it was taking to get these referral appointments, and also if patients were actually making it to these appointments. They analyzed the data and looked for room for improvement, in which they found several. In the current process, there was not real-time provider-to-provider communication. There also was no clear explanation of the reason for the referral. They made improvements on these and implemented both of those into their new process. They also came up with a template designed by PCPs and specialists both to improve the efficiency of the referral process. They implemented these changes and found drastic improvement, and they controlled this by continuing to use their new documentation process. In this study, they never determined what they would define as a defect, or how long the delay would have to be for them to define it as an error. So they were not able to statistically analyze to see if they ever reached that Six Sigma mark, but they did find a drastic improvement in their results. As an advanced practice nurse, you can use this DMAIC cycle to improve your processes in your daily work. That concludes this presentation. Thank you guys for watching.